tight schedule stands as a testament.
The representatives of the Department of Foreign Affairs and Trade, the DFAT, the representative of the Fiji National University, Associate Professor, School of Public Health and Community Medicine at the University of New South Wales, and Principal Investigator on the SHIFT project, Dr. Virginia Wiseman, representatives of our development partners, non-government organizations, representatives from civil society groups, academic institutions, senior officials of the ministries, of line ministries, Ministry of Health and Medical Services, officials, University of the New South Wales SHIFT project team, invited guests, ladies and gentlemen. That's quite a mouthful. I think first of all, I'd like to say it's a pleasure to be here this morning. It's a pleasure to be here with all of you to launch the SHIFT study report. The SHIFT report has assessed the fairness of healthcare financing in Fiji and gives us information on whether Fiji's healthcare financing system is making progress towards health for all. And that is something that is always important to all countries around the world. The report is very timely because it provides the ministry with evidence on how we can further improve the financing of health service delivery to ensure that everyone in Fiji can access healthcare services without financial hardship. And that's a very important part of what we're trying to do, because it's an obligation under our constitution, where we are required to provide healthcare services to everybody in Fiji. The aim of the SHIFT study was to assess equity in health financing in Fiji. The report seeks to provide information on how fair the current health financing system is and where attention is needed for improvement. And I think that's an important thing for us. Where do we focus our attention so we can provide more equitable access to health for everybody in this country? Fiji is seeking to deepen its commitment to equitable access to health care and to make universal health coverage a reality in our country. The Ministry of Health and Medical Services has just completed developing our new strategic plan for the period 2016 to 2020. And this, I think I need my glasses. And this also captures the government's commitment, the Fiji First government's commitment to health, especially in relation to our constitutional provisions on health. The National Strategic Plan on Health is aligned with the government's priorities for the health sector. It's also aligned to the global post-2015 development agenda and the United Nations Sustainable Development Goals, which builds upon the Millennium Development Goals that preceded them. We've also taken into account the Healthy Island vision of the Pacific countries that has been considered as one of the key frameworks in developing this document. Based on the Healthy Islands vision, the Ministry of Health and Medical Services has initiated the Wellness Fiji approach, that is the basis of Fiji's primary health care model of delivery towards reaching people in the various settings in which we work, whether they are settings in where we live, where we work and play, and we hope to be able to achieve this through expanded partnerships between the peripheral health workers and local communities. Many of the themes that are highlighted in these development frameworks are cross-cutting, and they are integrated throughout the National Strategic Plan, which has two main pillars. First, Pillar 1 emphasizes the strategic improvements to health service delivery, and Pillar 2 focus on health system strengthening, making sure that we have strong systems in place so we can deliver health services right across the nation. It is under Strategic Pillar 2 where priority areas such as equity and access to quality healthcare have been strategized within the ministry towards this vision of achieving universal health coverage through sustainable financing of health system. We have a specific goal under Pillar 2 which looks at sustainable health financing, because we need to make sure that in the future, as we try to reach all the people in our country, that we have financial systems, ways of financing health that can be sustainable into the future. Universal health coverage is a cross-cutting issue, and is reflected in Pillar 1, as I've just mentioned. In order to address inequity and inequality issues and achieving universal health coverage, healthcare financing needs to ensure that contributions to the cost of healthcare are in proportion to different households' ability to pay, and that will always be a challenge. And also to ensure that the poor are protected from the financial shocks and that services are accessible. A study on the feasibility of social health insurance for Fiji, released in June 2013, revealed that the government of Fiji, by funding an extensive delivery system including hospitals that is almost free for all patients, has chosen to prioritize equity, risk protection and access for the poorest. In terms of health outcomes, Fiji's health system is a good performer, relatively good performer, and does better than a lot of other countries in terms of progressing towards universal health coverage. The compilation of 3 rounds of the National Health Accounts Report provides a monitoring and evaluation tool to track and provide better insight to policymakers on questions on the flow of funds, where the money comes from, who provides the services, and what services are being provided. The SHIFT study uses the National Health Accounts data as well as other types of data for its assessment of how equitable Fiji's health financing system is. Ladies and gentlemen, this insight will provide insight on how we are performing and areas that can be tweaked, that we can improve on to improve performance. Financing information is an essential input for strengthening policies to improve the functioning of health systems and thereby further strengthen the government of Fiji's effort in prioritizing equity, risk protection, and access and coverage. I take this opportunity to thank everybody that's been involved in this exercise, to thank all the stakeholders that have participated in this project to make it a success. I would like to thank you all for being here this morning, for your presence, as you are all considered important stakeholders in ensuring government's ability to make well-informed decisions on the future of healthcare financing and health service provision. Finally, I wish to thank the University of New South Wales, all the way from Kensington, here in Fiji, the Centre for Health Information Policy and Systems Research at the Fiji National University, and the Ministry officials for the collaborative and supportive work in having this wonderful document prepared, which should provide vital evidence and impact on the quality of health policy decisions made by government. And we look forward to making progress on making sure that we can have better access to health for everybody in this country. I now officially launch the report, and may God bless us all.